My name is Marcin Iwaniki. I'm a AAA fellow. I'm also a faculty member at Stevens Institute of Technology, just right across the river. For past 10 months, I spent time at NSF, immersed within a smart health program. And I'm here to support my colleagues from NSF who are on Zoom. And so I'm going to introduce two wonderful program directors that I had the privilege to work with within a few months. Goli Amini, Dr. Goli Amini, who's been my mentor at NSF, and she's been really championing a lot of things at the Smart Health, and Dr. Dana Wolf-Hodges, who is from NIH, and they work tirelessly together to run this program. And they will talk about you right now with the presentation, what this program is all about, and answer any questions you have if you considering applying to this program. So they are the really right persons to talk to. Okay, within further ado, I'd like to welcome Goli and Dana. And Wendy, I didn't know. So
yes, I was there.
Yeah, so Wendy also has joined. So you guys just heard from Wendy. So Wendy's gonna kick this session off for the aspiring PI. Thank you.
Good morning, everyone. It's great to be. Maybe we should mute the conference room because it does echo. Can we do that?
This one is.
All right. That's a little better. I hope you guys can still hear us. Good morning, everyone. Yes, I'm so glad that Wendy's here with us as well. You all know her, and she was my mentor, and that's how I got started. So it's great to be on this panel together, and she's kindly accepted to help us answer some of you all's questions, which we are going to wait till the end. Again, my name is Goli Amini. I'm an associate PD and the co-lead for the Smart Health program on the NSF side. Dana, would you like to introduce yourself as well?
Sure. Good morning, everybody, and sorry that we can't be there in person with you all today, but I think we're all really happy to be able to do this virtually. I'm Dana Wolf-Hughes. I am a program director for Smart Health, but I work at the National Cancer Institute, and I've had the pleasure of working with Goli and Wendy for many years now on this program. So with that, I will hand it over to Wendy.
Hi, I'm Wendy Nelson. You all know me, and I'm just super grateful to be here and be with my wonderful colleagues, Goli and Dana, and Martin, of course.
Thank you all. All right, without further ado, let's get started. We're going to give a little bit of a background on the program. And then, like I said, at the end, we're going to take some time for questions. The Smart Health program was founded to support high-risk, high-reward programs that are projects that advance science and computing within the context of computing and engineering, really many disciplines, mathematics, statistics, behavioral sciences, but within a context of health and answering a biomedical and public health question. It is meant to address the research gaps in these areas, and it is meant to have a team of appropriate expertise in the areas, at minimum 2 areas that are covered in these projects. The activities should complement rather than duplicate other core programs in NSF and NIH. And for additional information, you can refer to our program site, our program page, which also includes the video recording of our webinars and additional information. And you guys can always reach us on our alias email. This program supports basically integrative projects. Our next due date is October 3rd of this year. We are already receiving one-pagers, so thank you for starting to get those to us if you already are. The total project funds are 1.2 million total cost. That's about $300,000 a year for 4 years. Again, interdisciplinary teams are required and a contribution to foundational science for at least 2 of the disciplines listed. with basically health as a use-inspired case for basic research. I wanted to include a little bit of a quote from the solicitation here for more specificity. The solicitation notes that the projects must make fundamental scientific or engineering contributions to 2 or more disciplines. These can be computing and biomedical area. It can be computing and engineering or math or cognitive science. But then again, it must address a key health-related process and or problem. We have a list of topical areas that we cover. This is not meant to be prescriptive, but rather sort of an idea, an area of the places we are looking at. For example, fairness and trustworthiness in the context of AI and AI models and human AI systems for decision-making, transformative analytics, whether it's multi-level or multi-scale data, or how it's being presented and visualized, really next-gen multimodal sensors. They can be, it can be design or actual fabrication of these new sensors. We're seeing a lot of exciting movement there with really looking at different types of sensing and combining various different things. We're still looking at cyber-physical systems like human-in-the-loop type of systems and technology platforms for basically delivering health interventions. Imaging is still a big part of our portfolio, whether it's pattern recognition or visual searches or image interpretation, that all falls under imaging. And we are doing robotics and biomechanics in a sense of next-gen systems that advance usability and effectiveness and have new methods that are context dependent. If I want to give a chance if Wendy or Dana, if you guys have any input on sort of areas. Okay. Then we are going to, next we're going to look at basically how review panels are conducted within NSF and NIH, as joint panels are handled with us between NSF and NIH, the review criteria, intellectual merit and broader impacts, and the technical and health areas that are being looked at. So I'm going to hand things off to Dana to take us over the next few slides.
Thanks, Goli. So this review process is somewhat similar to what you all are probably familiar with at NSF, but somewhat different in that NIH participates. So as one would typically do when applying to NSF, you would create your proposal, complying with all the NSF requirements, and submit that by the due date to NSF. NSF and NIH then collaboratively work together to go through those proposals and develop joint review panels, which are hosted with NSF PDs and the presence of NIH scientific review officers. Those panels during the discussion will get the NSF score. They will also receive NIH score. And the reviewers will have expertise across both agencies. At NSF, you'll get the qualitative recommendations, ratings and summaries, the reviews and summaries on the NIH side, as well as the quantitative score. Once that happens, we go through a process together where on the NIH side, the applications are percentiled as well. And NSF graciously gives NIH time to select applications to move over to NIH for funding. If that were to occur, you most likely will receive an email from Goli first, and then a follow-up with me for more specific instructions so that you can take your application and transform it into the NIH format. So up until that point, there's nothing you necessarily need to do for NIH, and the PDs on the NIH side will be there to help walk you all through that process at the end. Then they go through their normal funding process at either agency. Next. So we get a lot of questions about what would be of interest, what is typically funded through the program. You can go and look for what has been funded at the link provided, nsf.gov /award search. Just type in SCH : hit the search button, and you can search any grant that's been funded before, and this may be helpful to understand what has been successful and things that maybe have been funded before that would not be maybe necessarily considered as innovative. Next slide. You can also do the same thing, same sort of approach on the NIH side. So once those applications come over to us, they're no longer in the NSF system. They receive an NIH grant number. Same search terms apply, except this time you'll be looking at reporter.nih.gov /advanced-search. And just search the title. So if you look on the right, instead of looking at terms and abstracts, which can sort of mess some things up, just look at the project title. Next. So I will hand it back over to Goli.
So I think there was one thing I wanted to reemphasize, that these proposals are written for NSF. So we do talk about this joint process and then the selection by NIH. And one of the questions that we frequently get is, how do I have to make it suitable for NIH or address it for NIH or do it something that, how can I increase my chances or respond properly to being picked by NIH or NSF? There is no such thing. Like, everything is coming from NSF, it's being reviewed by us, as Dana already outlined. And you won't have to, like Dana already mentioned, you won't have to do anything until you've heard from us about NSF or NIH. In the next few slides, we're going to talk about several common issues with smart health proposals and what do's and basically some do's and don'ts. But before that, I wanted to, me and Dana wanted to mention about sort of some of the basically maybe changes that are coming this year, right? Especially for staffing and sort of ranking of, well, not ranking, but sort of maybe certain level of proposals that we wanted to, that we might be considering as opposed to others. And I think, Dana, you phrased this well when we were talking. Do you want to share anything about that now, or do you want to wait till the end? Because we are starting on what not to do. So we could talk, it might be good to prime everybody with that.
Yeah, so in the past, we've received a lot of proposals, especially in the past few years. And we have seen, while NSF does not allow for resubmissions, as you would maybe see at NIH, these all come in new, we have been tracking the number of proposals that may have been submitted in prior years. And if you've gone through the process before, you obviously, you've received reviewer feedback, and we've seen quite a number of things come through where reviewer comments haven't been addressed. And while the panels are new each year with potentially new reviewers, in a lot of cases, the comments they provide from year to year, regardless of who is on that panel, are fairly consistent. So if you've submitted 2-3 times already a similar proposal, I would consider either a major overhaul or moving in another direction, as well as the fact of being very mindful about the fact that there are requirements and meeting all of those requirements in your application. Because of everything going on at both agencies right now, I think everyone wants to see PIs be successful, but we are undergoing major staffing changes and also at the same time, potentially changes in budget. And so quality over quantity, don't just keep, trying to flood the zone with a bunch of proposals. Be very thoughtful, make sure that you're looking at your applications, you're meeting all of the requirements, attaching all of your plans and whatnot, because there may just not be that wiggle room moving forward for, you missed a page in your application. Those may just be kicked back moving forward, as well as the ability to fund as many proposals may be problematic as well.
Yeah, I would say quality over quantity this year for sure. It's being mindful of the time and space we have on our side, but also of yours. It would probably be a better fit to put the best effort on making one great one rather than trying to, like Dana said, just flooding the zone and applying to everything. We've been getting a lot of increased inquiries, so we do want to encourage everybody to be super mindful about it and improve quality as much as possible for any proposal that you're going to be submitting this round. So let's go to some of the classic, sort of the major things that come up with some of the problems and issues, or how to deal with them in the proposals that we get. The one big thing for us is like when the one big problem is not describing your fundamental contribution to the scientific areas that you're applying to. So it should really be the advancement you're making to basic science should be really highlighted and clear for a multidisciplinary audience. There is going to be scientists of your discipline and clinicians of your discipline in the room reviewing these proposals. So the clearer it is for a multidisciplinary audience to understand while still amplifying the basic science advancement, the better it is. One of the problems is that a lot of times we see applications of known technology to a health issue. Just because that technology or algorithm hasn't been applied to this particular health setting, it doesn't mean that it's new science, although it's very valuable, but it should not be sent to NSF. It could potentially be returned without review. So you really need to ask yourself, what's novel? What can get the best paper award? And how is this advancing computing or engineering within the context of health? The other problem we see frequently is intellectual merit statement of basically what you're going to do rather than what it is that your contribution is. So we want you to describe your project. We want you to tell us what it is, but we also want you to tell us why does it matter? How is it specifically or exactly advancing this area of science? What do we not know already that you are going to be addressing? Don't write a page 7 proposal, quote unquote. I think Wendy coined this term, but it's basically.
It's my term. Everybody,
Yes.
Don't do this to us. Don't make me read till page 7 to figure out what you're doing. Often there's like 6 pages of description of a health problem. That doesn't get us anywhere. What are you doing? And why are you doing it? And what's the science?
Yes. What is the science? Tell us what the science is. The health issue is a big motivator, but we need to know where the scientific contribution is. The broader impact becomes a question, I think, especially now, or I guess at any times, but it can't be just addressing the health problem. The health problem you're addressing is basically the test bed for the technology that you're proposing or the advancement that you're proposing. The broader impact should go beyond the health problem. It should be how your science is applying to other areas and the contributions that you're making beyond health, the education piece, all those things.
Remember, we still do education and outreach. So do that. Highlight it in here. This is an NSF review. We care about this thing.
Yes, and it should be to a general population, not specific to a certain population, but the advancements and the education pieces are still very, very important. One huge thing, this ends up being a deal breaker lots of times, is demonstrable research expertise for the team. If you're a computer scientist, the clinical person should not be an afterthought. It should not be somebody that you're like, oh, well, we have this expert. He'll tell us if we're doing something wrong or whatever. It should be an integral, essential partnership. And you need to be able to show that you guys are actually working together and that it helps make sure you're asking the right questions and proposing the right things for answering them when that partnership is integral and from the beginning. The teams must have the health and technical research expertise. It doesn't necessarily mean it has to be a clinician, but for example, for the clinical side, but it has to be somebody with those expertise.
So I just want to say, if you were going to do a proposal focused on new AI, you wouldn't bring a networking person to do it. So if you're going to do a thing on eating and heart disease, don't bring a surgeon. Surgeons don't worry about eating in the way that clinicians that are treating, somebody whose research is all about behavior in these diseases, that would be a much better fit. So just like you think about the people on your technical team, think about people that are on your biomedical side. There's all sorts of expertise, but often we see like, what is this person in here for? There's a pediatrician works with children on an aging study. Like, not sure why that happened. Happened to be the person they worked with, so that seems like that was the only reason. That's not going to get you funded. So pick your partner and your problem well.
Yeah, and our reviewers can notice that really quickly. Like Wendy said, when those expertise are not there, it just questions your feasibility and confidence in what you're proposing. Feedback. We encourage one-page summaries to SCH correspondence at nsf.gov. Like I said, I'm already starting to see some of them, and we do see them year-round, but especially closer to the deadline, and we encourage that. We are kind of, as Dana mentioned, we are facing staffing and budget challenges that are different from years before this round. So we are kind of putting a tentative deadline of end of August for these. We want to make sure that we get back to everybody that reaches out to us, and we do go on a first come first serve basis. So the sooner you can get your summary in, the better, and we will share it with our cluster and make sure that you get the appropriate feedback for your area from the PDs that cover that topic. The summary should address your intellectual merit. Please highlight it as clearly as possible where those advancements are to knowledge, the broader impact, potential to society, and contribution to basically this area of science, societal outcome, education. Don't send us specific aims. Smart Health proposals are reviewed by NSF, again, like I said, so it is send it as an NSF summary, NSF proposal. And like I said, ask early. We're looking at end of August right now for a tentative deadline. Dana, did you want to comment on this at all? Or Wendy, before I move on?
Yeah, so the reason we're saying end of August is because applications are due October 3rd, and you all will have to have a time to be able to make any changes that are sort of sent back to you from NSF and sometimes NIH, depending on the sort of review that's necessary of your one-pagers. And if you all have been part of these sort of workshops in the past, you'll notice that, there are less people here than in prior workshops. And so for the most part now, it's just really Goalie and myself. And so that is 2 people to review all of these one-pagers, and there are typically over 100 applications that come into the program. So that's 100 potential one-pagers. So submit early, and then we can make sure that we can have sort of robust feedback for you, as well as give you time to make changes or ask any clarifying questions you have of us so that you can submit the best proposal that you can.
So we've been talking a lot about the evolving landscape of the program and the proposal landscape in general. So I'm going to hand things off to Wendy to kind of talk to us a little bit about some of the things that are changing, and then we'll move to the Q&A section.
So indirect costs. You all, I'm hoping you're keeping up with the news, although maybe you don't want to. But indirect costs, there was a proposal to reduce indirect costs there's an injunction against that with the courts now. We are not changing indirect costs. So submit your proposal just like you would. If indirect costs get renegotiated, that will be a separate thing at a future date. We don't know what's going to happen there. So do what you would normally do. I have heard all sorts of things about people saying, oh, you should put in 15%, whatever. Don't do that. Do what you should normally do. This is right now, this is completely on hold with the court systems. Let them negotiate it, let them work it out. These are negotiated rates with HHS for the most part. So they will work this out over time. Budget, your budgets on these are up to $1.2 million. We are all facing budget cuts this year. Smaller targeted proposals are always nice, always appreciated. But the one thing I can't guarantee is budget cuts might happen, but we will talk to you about that. We would ask you to rescope if it needs it and things like that. So just do your indirect costs like they should be. Think about your budget, being thoughtful, and don't think you have to go $1,999,999. Don't do that. I can't tell you how many we get come in right at the cap. If you need the cap, that's one thing. If you don't, there's actually a real reason to be a little low. It catches everybody's attention. And if you're scoped in a way that makes sense for the budget, people appreciate that. Staffing, are we talking about staffing for us? Sorry, it's a little crazy this morning.
Yeah, I think that was initially the thought. Yeah.
Okay, sorry, we have the governor of Virginia downstairs giving away our building right now. So NSF is moving. Don't worry, folks. We'll still be here. We're moving. We don't know where we're moving to, but yeehaw, we're moving. But staffing. So I think Goli did a beautiful job, and Dana, we are in a hiring freeze. It's been a pretty tumultuous year at NSF and NIH on these issues. So all I will say is be really thoughtful of the staff. Also, don't ask staff questions they can't answer, because I have a funny feeling you all have a million questions. If you really have those questions, come talk to me. I'm more than willing to put my neck on the line. I'm not willing to put anybody else's. So don't make people awkward by saying, oh, what's happening here? But also be thoughtful about the fact that we've had much bigger staff numbers taking care of things in a way. And this year has just been a significant challenge timing wise and staffing wise. So just be aware, like Goli and Dana were saying, please if you want feedback on your one-page survey summary, we want you to get feedback. We do. It helps everybody, but we don't want to get it. Don't want to get it 3 days before it's due, because we just can't do that. Goli and Dana both have things they have to be doing aside from this. This is not their only job. So please, give them the time to read it. The other thing is it gives you the time to incorporate their ideas when somebody sends me a message and says, how does this fit Smart Health? I'd like to really think about it and then send a message saying, here's the things, this really fits. This, I'm a little confused about what's happening here. You should spend time really thinking about how do you incorporate that. And by the way, don't put your proposal in the day it's due, because when it goes bad, you're going to get it returned without review, because we don't have enough people that are going to call you up and say, oh, wait, you're missing this. We can't do that anymore. So I can't tell you how many people have realized after they submitted, I forgot broader impacts. I forgot to have the collaboration plan. Oh, I didn't do anything about human subjects. Put it in a week in advance and then look at it before it's due, and then go, yikes, I forgot the collaboration plan. Or wait, somebody uploaded 2 letters and no collaboration plan. Check that out. It really kills us to return these things. We don't like it. It makes us sad, because you spend a whole lot of work.
That's the most painful part of my job, to be honest, where we have to return proposals for missing very obvious things that it might have been something that the PI forgot or the administration submitting it on your behalf. There's just something that just got left behind, and we have to return a whole proposal because of that. So, as Wendy said, please, yeah, do it a week before and make sure all the pieces are there. Sorry, Wendy, for cutting you off. Go.
No, no, no. I think that was a great way to end it. We want you to do well. We want the science to get funded. So we're not telling you this for any other reason than if you get it in early, you're going to get feedback that's going to help your proposal because Goli and Dana have sat through hundreds and hundreds and hundreds of proposals and panels, and they've listened to what the things that people key in on. When you get to that, but we want to see you do well with this. So please give us the opportunity to let us give you feedback and then use that feedback. Get it in early. Make sure you don't you miss a year just because of a stupid thing. I have talked to, and by the way, this is not junior PI problem. I have actually returned proposals from very senior, extremely well-known people who go, "Oh crap. Oh, this is embarrassing." And they don't even argue because they go, "Whoa, I completely blew that." But nobody's immune from an occasional issue or mistake. So just don't get caught on one. Don't do one. All right, Goli, back to you.
Thank you, thank you. So that is everything we wanted to present. We wanted to leave as much time as possible for Q&A and answering your questions as well as we can. And we are so grateful to Wendy for being here, for answering questions that we can't or trying to anyways. So with that, I'm not sure how the Q&A session is going to be organized in the room. So I'll leave it up to you guys and Marcin. Thank you so
Yes,
much.
I'm here right on the stage,
and
and I just want to say thank you for this wonderful and very enthusiastic and very detailed overview of the Smart Health program. So my job here, guys, is
we can't hear
to
the room,
direct.
by the way.
Can you hear me?
Before. I don't know if it's
Can you hear me?
we can't hear anything.
Can they hear me? Can you guys hear me on Zoom? No?
Yes, yes.
Yes, right now? Okay, great. So I'm going to repeat this one more time. I'd like to thank you so much, and I appreciate this very detailed, enthusiastic overview of the Smart Health program. And I've been very, really, again, fortunate to work with all these people right on the screen. So we will take questions now. And really, if you have questions and you're considering applying for the proposal through the Smart Health program, those are the people you really want to talk to. So take this opportunity and ask the questions, and I'll be moderating this right here on the stage. Okay.
Can you hear this one?
We can hear you now. Go ahead.
Help.
James,
Can you hear it now?
Oh,
Can you hear us? Can you hear us now?
Yes, yes.
Yes.
Okay, so I think you can actually see us too, which is weird because you're just faces on a wall. So anyway, Wendy, this is kind of bridging the two sessions here a little bit. In the previous session, you mentioned medical device security as something that, NSF is probably interested in. I know ARPA-H is interested in it. But I've never seen a pathway through SCH to submit a improving medical device security proposal. Is there a pathway for that, or is this out of scope? Or is it up to me to define it in a way that it meets the requirements, which is probably the answer?
That is the answer, James. Well done. No, I mean, so I think this gets at the question before on, is it SASE or is it SCH? Sorry, you guys, that was in the previous session. But you have to define your project for the program. So you really do want to spend some time thinking about that. Boy, that echo is terrible.
Yeah.
But just so you know, this is why sending a one pager is really helpful, because if it's all about medical device security and it doesn't feel like SCH, goalie, one of us will talk to our friends in SATSI. We might even talk to our tip friends and say, hey, where does this fit? Um, we do try to get we if it doesn't fit what we're doing, we try to talk to others. Again, we're trying to help good science get funded. So, but this is how you frame your problem. Many problems can go in different places.
Thank you for all the. Yeah. No, I think she's talking. Yeah. So are you muted? So we cannot hear you.
Can you hear? No.
Hello?
Dana, I think you're muted.
No, I think which.
We can't hear clearly. I think somebody's speaking.
Okay, but who is? Hello? Can you hear me?
Yes.
Yeah. Oh, okay, great. I have a question about the healthcare data, right? So I'm not really, I just started working in the healthcare domain, and I have, and also in the AI domain, right? So one of the things I think a big challenge is availability of the data sets. So I do work with, have a collaborator with a hospital. So whenever we need to do the experiment, then I need to send the student to the hospital. They need to have like a temporary employee badge so they can have access to the data. And then we also have some public available data sets, but when we submit paper to conference, usually they say that's not enough. So I have a question about, what is the data considered like availability considered sufficient when we submit a proposal? Sorry, I cannot hear you.
Yeah, I was going to. Yes, I can.
Oh,
I can.
we cannot hear you now.
We are not speaking because I felt like I can hear my own echo. So I assume you guys can hear me too.
Can somebody wave if you can hear us?
Yeah, we are seeing the. Oh,
there's
here
a wave.
we are. Yeah.
You got it.
They can hear us. Yeah. I think I was actually on the same page as Dana. It really does depend on the type and amount of data or samples. Really does depend on what it is that you're trying to do, and the reviewers are well versed in this. It's a common with all these interdisciplinary health-related research projects. This is a common question, right? And so it really is going to depend on whether you're going to be able to do what it is you are aiming with the data that you're proposing to collect. You know what I mean? It's really project based. I don't know if Wendy, you have any better comments on this, but.
No, and yeah, it's always project based. It's not, there's no standard sample size. There's no standard data set. The one thing I will say is, depending on what it is too, um, there often are data sets that are bigger that are out there that are not your local hospital's data, because that data is often got its own biases and problems. So, if you're thinking about a data set, look around. NIH actually has a huge amount of data Yes, you have to get it ready. Yes, you have to do this, but there's a whole lot of data in that world that can be incredibly useful to you. It often is a remark in review. Why didn't you use X data? You know, because like we didn't know about it, but actually finding out about that data can save you from having to have your student do this, that, and the other thing. So,
All right, thank you.
Very good point.
Can you hear me? This is Sarah from the University of Virginia. I have a question. First off, I wanted to say that I really appreciate this Inspiring PI workshop and panel. It has been helping me a lot from previous years to shape great proposals. And also, I wanted to ask for a lot of junior PIs because we attended this workshop because we want to submit proposals to the Smart Connected Health program as like for new PIs and especially under certain, like the current uncertain conditions. And I was wondering if our program directors have any suggestions for the new people, junior people, especially when they just start their career.
Well, go ahead, Dana. Sarah, can you hear us?
no, they just muted Sarah, and I think now we may be heard.
Just give us a thumbs up.
Okay.
Okay, great. Go ahead, Dana. Go ahead.
Yep.
I cannot hear Dana, but I can hear Goli and Wendy. Sorry, for some reason, I cannot hear Dana, but I can hear Goli and Wendy.
You can't hear Dana?
We cannot. We can only hear Goli and Wendy.
That's very odd because we can hear Dana in this Zoom room.
Okay, that's a
All right.
bit weird.
Dana, you want me to start it? All right. So I think I have so we all really appreciate the challenges of being junior faculty and all of the issues that you all are facing. And we know this is a really scary time for many of you. We get that. The one thing I said at the last session, Dave said at this session, do quality over quantity. If you're in your very first year, think about being a reviewer on a bunch of panels this year. You know, it doesn't just have to be smart health. It's a little harder to be on an NIH panel, although do they have an early reviewer program still, Dana? Okay, so there's an early reviewer program that the Center for Scientific Review has. You all have pretty amazing expertise, so you might very well be selected for that. But at NSF, we send out a survey. If you're interested in being a reviewer, send a message, you know, with a brief description of what you do, your CV, send it to the Smart Health email. And Goli will then put it in a list of people that, you know, make sure you get information from. Um, but you know, I will tell you that sometimes people I've seen PIs make incredible use of learning from panels. I had a PI, I think I saw the person 5 times in their first year as faculty, 5 different panels. And let me tell you, the second year, the proposals came in and got funded because they'd spent a lot of time thinking about these problems. And smart health, there's cyber physical systems, has some health components to it. Triple I and IIS, there's a lot of places that you can think about as you're doing this and really learning what reviewers read, what they're thinking about when they're reading. So, okay, that's Dana. Did that capture what you wanted? All right.
Yeah. Yeah, I want to emphasize the quality over quantity piece. Although Wendy was talking about the other clusters and programs within IAS and NSF as a whole, being part of those panels helps people like, so the way the NSF, smart health ones are run with the joint NSF NIH is kind of a unique thing for NSF, and I assuming for NIH too, because it's not often that you see those two processes happening in one. So the smart health panels can be extremely educational. Being on some of the other ones will give you better perspective on what NSF is looking for and how to possibly right size your proposal. So it may be a small for III, for example, rather than a full proposal for smart health, or vice versa, or something like that. So I want to second Wendy's comment and say try to be on as many panels as you can as a junior PI. And we love our junior PIs. We support them. We get really excited to see them funded. So we're here for you. And yeah, I think I'm interrupting the question. We don't
I
see
have
the
a
room anymore. We just see the wall. So
I have some questions.
okay, there you guys are.
Can you hear me? Can you hear me now?
Yes. Yes.
All right. I have a couple questions, maybe 2 or 3 questions if I can still remember them by the end. So my name is Xudong Liu. I'm from a smaller R2 University of North Florida. And I wonder if you can give some advice for someone like me, a faculty member who wants to do, submit proposals to SCH from R2 University. We have wonderful undergraduate students, master students. We recently started a new PhD program that has probably less than 10 students now. So that's my first question. My second question, there's the, I think when you talk about the last talk on real world data, talking about things we can do to help improving health for truck drivers, for people who smoke or things like that. I wonder, so if I have a proposal idea about improving or reducing lung disease patients, using data from other companies, maybe how the smoking data or their public transit, the buses they take, for example. So do you ladies sort of encourage collaboration with not even science companies, like let's say bus transit authority companies? That's my second question. And I have a third question. So I want to keep track of things. Maybe I'll ask the third question once you guys are done with the first 2 questions. Thank you.
So this is all a question of framing, how you're going to frame what you're doing. I think, can you hear me?
Yes. Yes.
Yeah, okay. I think this is a question of how do you frame it. There's very few questions that are out of bounds if they address a health problem. So, if you're looking at bus drivers and smoking or something, and you're trying to intervene, I don't know if you're trying to, there's a whole lot of data on what happens to people's lungs in these scenarios. So make sure you understand what the rest of you need the context on both the health side, and the bus company is not going to give you that, by the way, because there's no incentive there. But you also, so you need your help, you need the problem from the technical side. What are you doing that's new, right? It can't just be that we never looked at bus drivers before, because if you're looking at bus drivers, I'm pretty sure that's, I don't know, NIH at the CDC, because that's an industrial problem. But thinking about, we do partners. Lots of people have partners. They have industry partners. They have healthcare system partners. They have all sorts of different. Partners are great. They can help you do a lot of things. And at some level, when you're talking about broader impacts, if the bus company wants to figure out a way to help their drivers have less lung disease over time, and they're willing to work with you, that's a dissemination after the fact, right? You have more, for us, that makes it more sustainable. It makes what you're doing have even more potential. But but I think it really depends on how you frame this problem, because we will often get a problem that says, like, we're interested in mental health of kids in school and how it affects their education. It's really an education proposal. So it should have gone to the education world. But, or if it's an industrial problem, we want to know how to make buses better for people's health. That's not a smart health problem. That's a bus problem, right? It's a transportation problem. So think about how you frame it. And again, send in your one pager. If I was in an R2, that would be the first thing I would do. I would get it in early. And then if you read it and you go, I'm not quite sure, see if you can get up a time to talk to somebody about it. Because I really think this is part of writing a great grant is framing it. So, all right, Dana.
Thank you.
Can you hear Dana?
No.
Oh, can you hear? All right.
This is really weird.
Just put a thumb up if you can hear us. No thumb up. See, I think there's time between a lag here between when we. Can you hear us?
Yes, we can hear you.
They can hear
now
us.
you can. Good. Go.
What about Dana? Dana, say something.
We cannot hear Dana, sorry.
Oh my God, Dana, I'm muting you. We're muzzling you, Dana. I'm so sorry. All right. Goalie.
We can translate any, or rather repeat anything.
Dela, can you try like mute, unmute somehow?
Go on, goalie.
What I wanted to kind of refer to with the different types of institutions was maybe sometimes with the broader impact on educational opportunities, they end up being really great things that you could include. So don't underestimate those. And then the stakeholders, as Wendy said, we like to see different stakeholders. This is going to be great, but it has to feed the purpose, the health purpose, especially of the project, right? A lot of times, things that are on the edge, for example, with the example, it could also be improving like workspaces or that type of work, which doesn't fall within smart health. So again, a one pager, I think, would help clarify that to see if you're asking the right questions or framing in the right way. I feel really bad, Dana. If you want to say something, I can repeat it. No.
Yeah, we still couldn't hear her, Dana. But thank you for the answers so far. I think I appreciate it. And my last question, but based on what Wendy and Goli told me, I think the importance of framing the problem and matching the problem with the group of people doing the problem, that's really important. So how about the technical depth or the depth of innovation or methodology? Do you expect to see some breakthrough foundational mathematical theory in the proposal, or it could be mostly about applying AI?
No, we want to see that foundational. That is a key thing. If the foundational work that you're doing is mathematical, we want to see that in at least two areas, right? So you're doing something, you're advancing things on the math side and on the computing side. We want to see where those things are advancing. The health is the context, whether it is of bus drivers or dietary, monitoring, like we used as an example before. But no, we want to see that health, that basic research advancements. So do amplify that and make sure it's articulated well.
And I do want to, I want to add on that too, that while we require two areas, the advances tends to be much bigger in one area than another, but usually most of these projects have multiple components, and it doesn't have to be just computing and engineering or computing and this. it can be multiple areas of the same major discipline because there's a lot of variability. So, so think about that as you're doing it. But yeah, don't be afraid. I mean, somebody said to me, I don't know how to do this because you can't write an algorithm in here. It's like, what? Since when? In NSF, can you not put an algorithm? Can you not put that in your proposal? Don't be shy about the science. Although I will say these are multidisciplinary. So if you go way deep into your own weeds, don't expect everybody to know that. Be very clear about what you're doing. And actually, that's just good grant writing. Because if you assume that you're in your world, I occasionally will get a proposal. We'll go. What? They're so down deep into the weeds of their own community that they start off using acronyms. They start off with everything just way down deep. It's just really challenging when you're not sitting in that community. I had a proposal once on a panel where somebody said, all right, everybody, this is my community. We do this all the time. Let me explain what's happening here. That shouldn't happen. These panels are full of really smart people.
All right. Thank you for your advice, Wendy and the goalie. And Dana, I wish I could read your lips, but thank you still the same.
Hello, can you hear me?
I think I was getting a message to see if Dana can log in and out. We are almost on time, so I'm not sure.
Hello, can you hear me? Can I ask one question?
Yes. Go ahead.
My name is Meng Shen. I'm from Columbia University, and because I know this is a joint panel from the NSF and the NIH, and I'm more familiar with the NIH. I know for which we value the clinical application. So I just wonder for this joint panel, what will be the percentage about clinical application and the percentage about the method, the innovation in the method.
I don't know if you guys can hear Dave now, but proposals that are just application should go directly to NIH. We don't recommend. I mean, it's not within scope of Smart Health because all the proposals coming into Smart Health are coming through NSF. So we are looking for that technical advancement piece. If it's just applying a technology to an existing technology to a new health problem, then Smart Health would not be the place for it to come to.
Yeah, and also just it's kind of like the extension of this. It's kind of like an extension of this question. Yeah, because in clinically there are lots of for example lots of data science problem you need the methodology innovation to solve it. However, this kind of the intermediate stage because even if you solve some of the long-term problem but when you want to apply that to the real life, for example we have the HIPAA restriction, so that means they can be directly apply to the clinical scenarios, but it can solve the critical problem. So I just wonder for such scenario if we use the data science innovation to solve some clinical thing will this one be a suitable scope for this proposal?
Dana put in the chat that your proposal should put the NSF fundamental science first and the NIH or the health clinical application second. Does that answer your question?
Well, here, let me expand on it a little because I think one of the things is you can frame a proposal. There's plenty of compute people who apply to NIH and bury their compute advances. I can do machine learning. Here I go. And they're really doing cool innovation machine learning, but that's not what NIH is really. NIH wants to solve the problem. It's nice you're really great at machine learning, but making them nervous about your machine learning isn't going to help anything. At NSF, it's kind of the opposite, right? We really want to know what made your machine learning so hard. What was the thing that got in the way? The health problem is the use case for this. So right, it's really that's going to say, here's this problem. And it needs a solution, right? There's this big problem. It can't be solved in the traditional ways because we need a new way to do it. So you're going to bring in your method. So you can imagine you can frame this either way, depending on which way you go. But it's really the emphasis then is on the science, is really on what, if you're doing data science, what's new about the data science? And then also bringing in toward the end, how does that generalize to other areas? How does this help us beyond the HIPAA problem?
Yeah, part of the application would be showing that you can actually address the health problem that you are looking at, right? So it is not just a fundamental, but if this fundamental key gets resolved or solved or advanced in this area, then down the line, this is how it's going to improve the health problem. So that it is going to be applied at the end.
Okay, yeah, thank you so much for answering my question. So here is another extension. It's because for example, I solve a very important data science issue, for example, in the medical image. However, because the medical image is a quite large scope. It can be applied to the breast cancer. It can be applied to the brain cancer. So should my emphasis be I can solve this problem in the application for both breast cancer or brain cancer as an example, or I only emphasize the one side because, for example, I have more closer collaboration with the doctors from the Brain Cancer Institute. So that's my question.
This is actually a great question. This is a great question. This is a great question for balancing scope and broader impact, right? So you want to narrow the scope enough to be able to be effective, right? You want to work with your clinical partner. You want to focus on the problem, laser focus on the problem, right? Because we are looking at, for example, in brain, and it's going to be solved in this particular problem in brain and all that stuff, right? But emphasize that this can easily be applied to breast cancer and this then and all the other areas, for instance. That is the broader impact. That is basically saying, oh, I'm advancing science in a way that not only it advances imaging in this area, but it can, and the health impact can be way beyond the one area that we are proposing it for, and demonstrably so.
Can I ask one more question? Yeah. So because still in the medical field, the data resources is hard to obtain due to lots of restrictions. So for instance, right now, I have the breast data, and can I just make the preliminary result based on the breast? And however, I want to also shows that it has the potential to be applied to the brain cancer research. So in the proposal, I just tells you how this preliminary result and the fundamental method that we have developed can be applied to the brain. So well that helps. Oh, okay. So
yes,
that's
let's focus on the breast. Let's focus on the data you have and make sure that you are demonstrating the feasibility of that clearly and well, and then we can talk about the things that go on. I don't think you need necessarily, I mean, if you have preliminary results in other areas, it's good, but I don't think it's necessary to show that, as long as it's.
You're getting hurt with preliminary data with us most of the time. It makes it look like you've already done the work. So you want to write in your proposal in a way that gives people confidence you can do what you should do. You're good at this. You've done other areas in this. You've been working in this field. At the same time, you're still breaking new ground.
Right.
Oh.
And if you're having trouble with data too, make sure you look at the NIH. There's an awful lot of data there. They spend a lot of money on data.
Oh, okay. Yeah. Thank you so much. So that's all for my question. Yeah.
Great. Do send us a long answer.
I think we are a few minutes past, so this was the last questions, and I'd like to say again, thank you so much to Wendy, Goli, and Dana for this really wonderful overview of the program and answering the questions that are very important. And I hope you guys gonna be applying to the Smart Health program. Sarah, do you wanna say a few words?
So I
Just
wonder how. Okay, we can't hear you, Martin and Sarah.
can you guys hear us now or me? Okay,
Yes,
it's a
yes.
different microphone. So Sarah, I would think you would have to come back here. I was just saying that I would like to we would like to really thank you for this wonderful description of the program and detailed answering the questions so that the PIs had and for you guys that are considering the applying to the Smart Health program, please don't hesitate them. This is really your source of information. Sarah, I'm just gonna, if you wanna say a few things.
Yeah, I just wanted to say thank you, especially for over like federal people, and we as a research community, we really, really appreciate all your support and all your guidance for us to shape our proposal and to grow our community. And this cannot happen without all your support. We really appreciate that. Okay.
So we're so happy to be here, and we love the CHASE conferences. There's so much brilliant work gets highlighted every year, and we want to thank you guys for organizing and bringing the community together and helping, strengthen it. We say this all the time in panels, and I want to say this now. Smart Health is the PIs that are doing all the brilliant work. So thank you for all your hard work and adding so much to the program on every level. The panels, like all of it.
I want
Okay,
to
so
add to Goli's thanks to Goli and Dana, who have so committed to this community and work so hard to try to keep things going. So really appreciate everybody's efforts, the communities and your supporters.
Let's give a group
Thank you,
applause
guys.
to
Thank
all
you.
the program directors.
Oh, we can actually hear the clapping. The Zoom is not casting it out.